Story time. Many years ago, I was called to help on the floor. I was doing something called house SWAT, which is where you go to all the floors and you just help toilet patients, give medication, start IVs, all the basic skills that we would do as nurses. This particular day where this fabulous story comes from, I was working down on one of our medical surgical floor where I had a lot of friends that were working and they thought it was a great idea to help me help them with one of their more complicated patients. I was asked to go in doing a cleanup and a bed bath, that sort of thing, on a patient who had some incontinence episodes. Absolutely, totally normal for me. Seemed like no big deal. I was a CNA before I was a nurse. I was happy to help. The red flags started pouring in when I realized that everybody at the nurse's station who had been a part of asking me to go to this particular room were snickering as I was walking away, and it didn't really occur to me until after I had come back to the nurse's station afterwards. Why? I walk into, of course, an isolation room, which was no big deal. I put on a gown, I did all the things, walk into the room, and I see a very obese patient who was super duper sweet and a little disoriented, who was being cleaned up by a team of not one, not two, but three people. And I was the fourth person to help because of the numerous folds that needed to be lifted so that I could help get into, all of the places. When I walked in, I remember seeing something scattering across the floor, and I wasn't quite sure what it was. I thought maybe they had lifted a panis and like a cracker crumb or something had fallen out, but it was like black. I wasn't really sure. I noted that one of my closer friends, who was pretty strong stomached, had to jet out of the room and looked literally green, and she was covering her mouth with the gown. I didn't think anything of it. Weird stuff happens nursing all the time. Maybe she was pregnant, who knows. I began to lift folds and help my coworkers who are all looking away from the patient while doing pericare. I was trying to talk to the patient and make sure she was comfortable because this seemed like a very odd situation. A rag, put on some soap, and lo and behold, this labial abscess was infested with cockroaches. I too have a pretty strong stomach, but cockroach gina has been absolutely the most smelly experience I have ever had as a nurse. Ended up finishing up the cleanup. Gal was super grateful, very kind. We caught a couple of the cockroaches as they were scurrying betwixt her legs out the door. Did she know that that was the situation that was going on? No, I don't think she felt it. I think she had some neuropathy and maybe wasn't aware. She had been having weird tingly sensations there for some time. She basically septic because there was some sort of, labial abscess. I don't know what happened, but there were cockroaches. We saw them. They were on the floor. Therapy was had.